Good morning all viewers. I'm Dr. Rohit, neurologist from Mallareddy Narayana Hospital. Today I'm going to tell you about brain stroke, CVA. That is the cause of paralysis in lot of patients. So as of now, we are seeing a lot of young patients also suffering from stroke, that is a CVA. So my topic today is to tell the normal public to know about the symptoms that you need to recognize when a patient is suffering from stroke, and also the treatment options available right now, and what are the precautions you need to take to avoid the stroke from occurring. So coming to CVA, it's the brain stroke. It can be due to two causes. One is the blood vessels which are being supplied to the brain. If they're blocked due to any thrombus or a clot, that can cause a CVA. That is in 80% of the cases, it's due to that. It's called ischemic stroke. In other 20% of the cases, there will be bleeding. There is a bursting of the blood vessels which supply the brain. So it causes hemorrhagic stroke. This is a little bit dangerous condition which might require even a surgery in few people. So what are the symptoms we need to recognize when a patient, how do you recognize a patient has a brain stroke or paralysis? There is an acronym for this. This is called B-FAST. So the B stands for balance. If you see any patient who has a sudden loss of balance, you need to consider him to have been affected by a stroke. And next symptom is eyes, a sudden loss of vision in his eyes, decrease in vision which is sudden in onset. And F is equal to face, if there is any deviation of the face or in the face. And next is arm. If there is any weakness in the arm or leg, you need to suspect a CVA. And S is speech. If there is decrease in the speech quality, you need to consider as a symptom of a stroke. If any of these symptoms are there, you need to act very fast. That is the last part of the acronym, time. You need to attend to the patient and take him to the nearest hospital or a doctor, and they'll evaluate if the stroke is there, and whether there is a ischemic or hemorrhagic stroke. And this is very important because we are again repeatedly telling that it needs to be acted fast, because the recent advances in treatment of stroke are that if the patient attends an ischemic stroke patient attends in 4.5 hours after the onset of stroke, there are varied options today, which include thrombolysis. Drug is available which will dissolve the clot which is blocking the blood vessels. And also, if further also there is the options of around up to 16 to 24 hours, there are options in rare cases. We can do a surgery called mechanical thrombectomy, where the clot can be removed from the blood vessels. So recognizing the symptom of the stroke is very important, and you can't delay and take a patient after a day or two, because the prognosis or the recovery after such a stroke would be very poor if the treatment option is delayed. So what are the causes of the stroke? As with any other lifestyle diseases, and this is important, the causes are an increased blood pressure, uncontrolled blood sugars, and habit of smoking and alcohol intake, and bad cholesterols. These are the causes which can cause the brain stroke to occur in individuals. And also in latestly, any drug abuse can also cause clots in the blood vessels. And during the post-COVID era, we are seeing even many young people being affected with brain stroke. So it's becoming common in post-COVID scenario. So to prevent further strokes, all these factors must be kept under control. Any person above 45 years need to get his BP, sugars get tested, and cholesterol also tested annually, and avoid smoking and alcohol. And he need to be fit and exercise at least 5 days a week, around 45 minutes a day. So these all can control your risk factors which can cause a stroke. And always remember the acronym of B-FAST, so that any person in your family member or your friend, whenever he suffers from these symptoms, make it an emergency and take him to the nearest hospital at the earliest. You don't need to wait up to 4.5 hours. At the earliest, even 1 hour, 2 hours, at the earliest you can take, the better will be the results of the stroke. Thank you.